Okay, let's dive right in. So imagine you have this ticking time bomb in an artery in your neck, a blockage that could trigger a massive stroke at any moment. The huge question is, what do you do? Do you manage it with medication, or do you go for surgery to get it out of there? Today, we're going to break down why that decision has become way more complex and a lot more high stakes than you might think. And let's just start with something that sounds, well, completely backwards. The very operation that's designed to protect your brain could, in a rare but absolutely catastrophic twist, make it impossible for you to breathe. And this isn't just some minor side effect. We're talking about a life-threatening emergency that completely reframes this entire debate. So what exactly is this hidden risk? Well, it all comes down to a specific and very dangerous complication that every surgeon and every patient has to weigh in the balance. So here's what happens. The surgery is called a carotid endarterectomy, or CEA. Surgeons are working on that major artery in your neck. If there's some bleeding after the procedure, that blood can collect and form what's called a hematoma. You can just picture this mass expanding, pressing down on your windpipe, and potentially squeezing it completely shut. And listen, this is not just some theoretical 1 in a million risk. If you look at the data from a major international trial, you'll see that a severe hematoma like this happens in about 3.4% of these surgeries. Now, 3.4% might sound like a small number, but when it happens to you or someone you love, it's 100%. The consequences are immediate, and they are incredibly serious. And this is the crucial part. It's a cascade of dangers. First, you have the abrupt loss of the airway. A routine recovery suddenly turns into a desperate fight for every breath. But it doesn't even stop there. That same study found a really strong link between these hematomas and cranial nerve injury. In fact, in 28 out of 45 cases with a hematoma, there was also nerve damage. We're talking about things that can affect your speech, your ability to swallow, even facial movement. Okay, so we've talked a lot about the risks of the fix, but what's the actual problem we're trying to solve here in the first place? Well, it all comes down to a condition known as carotid artery stenosis. Think of your carotid arteries as the main fuel lines going to your brain. What happens with atherosclerosis is that this gunk, this fatty, cholesterol-filled plaque, builds up on the inside, making the passage narrower and narrower. If a piece of that plaque breaks off or a clot forms there, it can shoot straight up to the brain and cause a really devastating stroke. This one condition is the culprit behind a huge chunk of all strokes, about 1 in every 10. So how in the world do doctors find this silent threat before it's too late? Well, they use some pretty incredible imaging technology. On the left here, you can see an ultrasound, which uses sound waves to visualize the blood flow and find those blockages. And on the right, that's an MRA, which gives this incredibly detailed map of the arteries. You can clearly see where it's getting narrow. These tools let doctors see the danger and quantify the risk, sometimes years before a stroke might happen. And this all leads us right to the heart of the matter, the central dilemma that doctors and patients have to face. Once you know the problem is there, you're looking at two totally different paths forward. On one hand, you've got what's called best medical management. This is basically a powerful cocktail of modern drugs, antiplatelets, statins, blood pressure meds, all designed to make that plaque stable and prevent a stroke without ever touching a scalpel. On the other hand, you have the direct mechanical fix, surgery. Go in, open the artery, and physically scrape that plaque out. For a long, long time, surgery seemed like the more definitive answer. But that is changing. And this, right here, is where the story gets really, really interesting. The reason this choice has gotten so tough is because the medicines have gotten so good. So good, in fact, that they've completely changed the entire risk-benefit equation. I mean, these numbers on the screen tell the whole story. If you look back to a landmark study in 1995, a patient with no symptoms had about a 2.2% chance of having a stroke each year, even with the medicines they had back then. But fast forward to today, with our modern statins and antiplatelet drugs, that annual risk has absolutely plummeted to less than 1%. And in some studies, it's as low as 0.35%. That is a massive difference. Let's just pause on that number for a second. Less than 1%. Modern medicine, just with pills, has become so incredibly effective that for a lot of patients, the annual risk of having a stroke from this blockage is now tiny. And you can see how this completely changes the calculation for whether you should undergo a risky surgery. And this progress has set a whole new benchmark. Experts are now basically saying, look, for us to even consider justifying an invasive surgery for a patient who doesn't have symptoms, the total risk from the procedure itself has to be even lower than what we can achieve with medicine alone. The bar for recommending surgery has been raised incredibly high. So what does this all mean for the future of this operation? Well, the modern verdict is pretty clear. It's no longer a go-to solution for everyone. It's become a highly selective tool that's used only in very specific situations. So let's tie this all together. We know the risks of surgery, like that neck hematoma we started with, are significant. We also know that modern drugs are now amazing at preventing strokes. So today, surgery is generally reserved only for a small group of high-risk patients. Maybe the blockage is extremely severe, or the plaque looks really unstable. For almost everyone else, the decision is a careful, personalized risk assessment. And more often, medicine is winning out. It's just not a one-size-fits-all world anymore. And that leaves us with one last big question to think about. As our medications get even better, even more effective at stabilizing plaque and preventing clots, are we heading toward a future where cutting open an artery to clean it out becomes an obsolete procedure? A relic of a time before we figured out how to tame the risk from within?